Hello everybody, welcome to my channel Preventive and Social Medicine. My name is Dr. Mehta, first year resident in Community Medicine Department. In the previous video, we have discussed about the clinical features, complications and differential diagnosis of monkeypox disease. In this video, we will discuss about the specimen collection and lab diagnostic techniques used in monkeypox disease. In incubation period, patient will not be having any kind of symptoms and virus is not present in the bloodstream. So no samples are collected in incubation period. In febrile stage, virus will be present in the bloodstream. Nasopharyngeal or oropharyngeal swabs are collected to detect the viral DNA. In rash stage, virus is more concentrated in the lesions. So lesion fluid, lesion roof or lesion crust are collected to detect the virus. In recovery stage, specific antibodies will present in the bloodstream. So blood samples will be collected for examination of antibodies, for detection of antibodies. So for oral or nasopharyngeal swabs, we have to ask the patient to open the mouth and stick their tongue out. So sterile polystyrene swab is used to swab both the tonsillar arches and the posterior nasopharynx without touching the sides of the mouth. So place the swab into a screw capped plastic plain tube without any medium. So for nasopharyngeal swab, we have to ask a patient head is tilted back up to 70 degrees. Gently insert the polystyrene swab into the nostril parallel to the palate until the resistance is encountered. So the distance will be equivalent to that from nostril to the ear of the patient, indicating contact with the nasopharynx. Then the swab is rolled and kept inside the nostril for few seconds to absorb any secretions. The swab is kept in the same screw-capped container in which the oropharyngeal swab is present. So all of us are very familiar with the oro and nasopharyngeal swab techniques, as the same technique is employed in COVID sample collection. But only difference is that viral transport medium was used in COVID sample collection. Here we are sending the swabs in a plain tube without any medium. So next is the lesion roof and fluid collection procedure. First, we have to sanitize the lesion using alcohol wipes. Then using the scalpel, lesion roof is removed and sent to laboratory in a screw capped container, plain container. After removing the lesion roof, the lesion fluid is collected from the base using sterile polystyrene swab. Then this swab is placed in a screw capped plain container and sent to the laboratory. Next is lesion crush. First, we have to sanitize the lesion with alcohol wipe. Using scalpel, lesion crusts are removed and sent to the lab in a screw capped plain container. Then in the recovery phase, we will collect venous blood from the patient. First, we have to sanitize the collection area. Normally, the venous blood is drawn from the median cubital vein, either in the antecubital fossa or in the forearm region. 5 ml blood is drawn. So 2 ml blood is collected in EDTA tube and 3 ml blood is collected in SSGT tube. So EDTA tube is the blood collected in EDTA tube will be used for hematological studies, and the blood collected in SSGT tube will be used for serum analysis for antibodies. So we have to, so all the samples should be surface decontaminated. Then sent to laboratory safely without any risk of leakage. So let us see. Then urine sample collection. So ask the patient to collect midstream urine of 3 to 5 ml into the container. So sterile container, use it for routine examination to detect any bacterial or mycological cultures. For superimposed infections, any proteinuria. In some countries, it is also used to detect viral nucleic acid by PCR method, but it is not followed in India. Then there's an article in Economic Times. Sample of 5-year-old UP girl collected for suspected monkeypox. So the girl had complaints of itching and rashes on her body. She has no other health issues, and neither she nor any of her close contact traveled abroad in the past 1 month. So 2 more samples were sent to the National Institute of Virology, Pune, one from Hyderabad, and one from Goa. All the three samples were tested negative for monkeypox disease. So this is a basic triple packaging system. It was used in COVID sample collection. Like there is a primary watertight container in which we will keep the swab. Then we have to wrap it in the absorbent material. Then it is placed in a polythene, watertight polythene packaging. Then kept into a final rigid outer box. Then this outer box is placed in a cool box with ice packs. So in case of monkeypox, triple packaging system of monkeypox is different from that of the COVID. Here, the screw capped container. Lid of the screw capped container is sealed with the parafilm to prevent any leakage. Then the sample vial is covered with adsorbent material. Then a 50 ml centrifuge tube is used as a secondary container and neck is closed. Then it is again kept in a thermocol box with dry ice, which in turn is kept in a cardboard box unsealed, and the details of patients are labeled outside the box. So these slides depict the same thing. First, the lid of the screw capped container is closed. Then it is covered with absorbent material. Then kept into the 50 ml centrifuge container, secondary container. This secondary container is kept into a thermocol box with dry ice. Then this thermocol box is kept into the cardboard box and sealed, and the details of the patients are labeled outside the box. So the specimen is transported in accordance with the national surveillance and laboratory guidelines, using the fastest mode of transport with trained drivers or riders. So the temperature should be maintained at 4 degrees centigrade. So let us see the overview of diagnostic test. So in incubation period, we are not taking any sample. In febrile stage, we are using oral and nasopharyngeal swabs for PCR method. In rash stage, we are collecting the lesion fluid, lesion roof, and lesion crust. So these lesion samples are sent for PCR antigen detection methods. In recovery stage, we are collecting the blood sample. So the serum is used for antibody detection methods. In PCR, it is the most specific test to detect monkeypox virus. So viral genetic material is extracted and then amplified. So it is detected using nucleic acid amplification test. Then virus isolation can be done by cell culture or chick embryos, but it is time and resource intensive and not monkeypox specific. In electron microscopy, reveals virus morphology. And antigen detection. In antigen detection, it uses an antibody directed against an orthopox virus antigen. It proves the presence of an orthopox virus current infection. It is done on the lesion material. So it is collected in the rash stage, done on the lesion material. It is not monkeypox virus specific. So antibody detection will collect the blood sample in recovery phase. So uses an antigen directed against the antibody. It has a limited diagnostic value, detects current or past infection or vaccination. It is done on serum. It is not monkeypox virus specific. So in the next video, we will discuss about the patient management, like clinical management of the patient. Thank you.